CDC, the Department of Health and Human Services, the State Department, and other U.S. government partners are fully committed to confront the serious global health threat presented by coronavirus disease 19. CDC's public health approach to COVID-19 is built on decades of infectious disease expertise in prior public health emergencies such as SARS, MERS, Ebola, and pandemic influenza. Our goal is to keep America safe and to slow the introduction of this new virus into the United States. Our response involves multi-layered, aggressive containment, and potential mitigation measures as needed. These proven effective public health interventions include early diagnosis, isolation, and contact tracing. These public health interventions also include targeted travel restrictions as well as the use of quarantine for individuals returning from transmission hot zones such as Hubei Province, China, and the Diamond Princess cruise ship docked in Japan. Internationally, CDC is working with the World Health Organization and ministries of health across the globe to continue to combat this outbreak. CDC has deployed over 600 staff to the response, including staff supporting Japan, South Korea, and our country office in China. This outbreak underscores our national leadership role on the global scale and the necessity of strengthening our global capacity to stop disease threats at their source before they spread. When this outbreak was first reported in December 2019, China reported 27 cases of pneumonia linked to a seafood market. Today, there's more than 78,000 cases and over 2,700 deaths. Over the past 2 months, we've seen confirmed cases reported in 46 international locations, including the United States, and several of these countries now are reporting sustained community spread. In the United States, 15 cases have been confirmed by our nation's public health and medical community based on clinical guidance provided them by CDC. On February 26, CDC confirmed an infection with the virus caused by COVID-19 in a person who reportedly did not have any relevant travel history or exposure to other COVID patients. It's possible this could be an instance of community spread of COVID, which would be the first time this has happened in the United States. 3 cases have been detected among the Americans repatriated from Wuhan, and another 43 cases were confirmed among the cruise ship passengers that were repatriated from Japan. We commend the efforts of the government of Japan to institute quarantine measures on board the ship, and we appreciate Japan's cooperation with the United States government to evaluate and care and evacuate American citizens. CDC works in partnership with the State Department to assist in this repatriation effort of American citizens, both from China and Japan. All of the individuals repatriated from Wuhan by the State Department charters have now been released from their mandatory quarantine. These individuals are not at risk of spreading the virus to others and should return to their normal lives. Passengers from the Diamond Princess are in the process of completing their quarantine at several locations across the United States.
I want to ask you to speak about the danger of xenophobia in a situation like this. CNN reported last month on a disturbing example from the SARS outbreak when, and quoting them, people of Asian descent were treated like pariahs in the West. There were reports of white people covering their faces in the presence of Asian coworkers and real estate agents who were told not to serve Asian clients, end quote. We saw similar incidents during the H1N1 swine flu outbreak in 2009 and during the 2014 Ebola outbreak, and sadly, I've heard reports of incidents like this around coronavirus. So I'd like you to talk about why it's so important to avoid stereotyping people as carriers of the coronavirus and how incidents like these can be avoided and how they're dangerous really for public health.
I couldn't agree with you more. For those who've heard me talk before, I've always said that stigma is the enemy of public health in all its forms, whether it's in dealing with HIV, whether it's dealing with drug use disorder, whether it's dealing with obesity, whether it's dealing with a response to the coronavirus at this time. Stigma has no role, no place in public health. It's counterproductive.
So I think we're going to have to proactively get that message out to the American people so that we don't harm our own public health with stereotypes folks might have. Don't you agree?
Yeah, I will continue to echo it, and I think you make an important point because we have seen those reports, and I think, again, we need to re-echo that stigma has no role in public health.
Thank you, and thank you, Mr. Chairman. I yield back.
Our infrastructure in a bad flu season would overwhelm our hospitals and emergency room capabilities, slap on potentially what we don't know how bad coronavirus will get. We just have to be prepared for the worst and hope for the best here. I also want to make sure, and talked about this with some of my colleagues on both sides of the aisle earlier this morning, we need to keep politics out of this. This has to be a nonpartisan effort. This has to be about looking at the science, following the facts, and doing what we have to do to keep the American public safe, but then also to focus in on the international community. That's going to be extremely important. In addition, we have to make sure, in this era where, it's easy to put out false information, we do have a very concerned public. We're all leaders as members of Congress and have the ability to communicate effectively. So the more we can coordinate with the CDC and others to get accurate information out there to make sure the public is accurately informed and that we can quickly dispel any misinformation will allow us to do our jobs and allow you to do your jobs and our scientists to do their jobs better.